NCLEX PN review questions and answers with rationale mock test, 30 most asked questions. Question 1. A nurse is caring for a client with a new prescription for digoxin. Which vital sign is most critical to check? Blood pressure, apical pulse, respiratory rate, temperature. The apical pulse must be checked for 1 full minute. Hold if less than 60 bpm. Question 2. Which task is most appropriate for a PN to delegate to an unlicensed assistive personnel, UAP? Performing a sterile dressing change, assessing a new admission, assisting a stable client with ambulation, administering 4-push medication. UAPs can help with activities of daily living for stable clients. Question 3. A client has a potassium level of 6.2 milliequivalent/L. Which cardiac rhythm change should the nurse monitor for? Prominent U waves, flattened T waves, tall, peaked T waves, shortened PR interval. Hyperkalemia, K plus 5.0, causes tall, peaked T waves. Question 4. The nurse is teaching a client about a clear liquid diet. Which item is allowed? Orange juice, apple juice, milk, ice cream. Apple juice is clear, orange juice, milk, and ice cream contain solids/fats. Question 5. A nurse finds a patient's room on fire. What is the priority action? Pull the fire alarm, extinguish the fire, rescue the patient, contain the fire. RACE acronym: rescue, alarm, contain, extinguish. Question 6. Which side should a client with a right-sided weakness hold their cane? Left side, right side, either side, behind them. Canes should be held on the strong, unaffected side. Question 7. A nurse is caring for a client in skeletal traction. Which finding requires immediate intervention? The weights are hanging freely. The client reports mild itching under the pin site. A weight is resting on the floor. The skin is intact around the pins. Weights must hang freely to maintain proper traction. Question 8. What is the primary risk for a client with deep vein thrombosis, DVT, myocardial infarction, pulmonary embolism, stroke, kidney failure? A DVT can dislodge and travel to the lungs, causing a PE. Question 9. Which type of precaution is required for a client with tuberculosis, TB? Standard, contact, droplet, airborne. TB requires a private negative pressure room and N95 masks, airborne precautions. Question 10. A client is receiving nitroglycerin for chest pain. What is the most common side effect? Hypertension, headache, bradycardia, constipation. Vasodilation of cranial vessels commonly causes a headache. Question 11. Which food is high in vitamin K and should be limited for patients on warfarin? Apples, bananas, spinach, chicken. Dark leafy greens like spinach are high in vitamin K, which antagonizes warfarin. Question 12. A PN is caring for a client with a hip fracture. Which device is used to prevent adduction? Trochanter roll, abduction pillow, footboard, hand roll. An abduction pillow keeps the legs apart to prevent dislocation. Question 13. A client is 1 hour post-op. The nurse notes the dressing is saturated with bright red blood. What is the priority? Change the dressing, reinforce the dressing and notify the surgeon. Document the finding. Check the patient's temperature. Hemorrhage is a priority. Do not remove the original dressing, reinforce and call for help. Question 14. What is the first sign of a pressure injury? Blistering, non-blanchable erythema, eschar formation, bleeding. Stage 1 is defined by redness that does not turn white when pressed. Question 15. Which medication is the antidote for heparin? Vitamin K, protamine sulfate, naloxone, glucagon. Protamine sulfate reverses the effects of heparin. Question 16. A client with type 1 diabetes is shaky, sweaty, and confused. What is the first action? Give 15 g of rapid-acting carbohydrates. Administer insulin. Check a 12-lead EKG. Call the chaplain. These are signs of hypoglycemia. Follow the rule of 15. Question 17. The nurse is performing suctioning on a client with a tracheostomy. How long should each suction pass last? 5 seconds, 10 to 15 seconds, 30 seconds, 1 minute. Suctioning should be limited to 10 to 15 seconds to prevent hypoxia. Question 18. Which position should a client be in for a soapsuds enema? High Fowler's, prone, left Sims, supine. Left Sims allows the fluid to flow naturally into the sigmoid colon. Question 19. The 5 rights of medication administration include: right client, drug, dose, route, time; right doctor, client, drug, ward, charge; right time, pharmacy, dose, weight, age; right color, shape, size, dose, price. The core rights are client, drug, dose, route, and time. Question 20. A client is experiencing a tonic-clonic seizure. What is the priority nursing action? Insert a tongue blade. Restrain the client's arms. Protect the head and turn to the side. Administer oral glucose. Safety is the priority. Protect the head and ensure a patent airway by turning them.